Hello and welcome to our COVID-19 update where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello Minister, thank you for joining us again today.
Well, thank you very much for having me on the program.
Okay Minister, now over the weekend I know the ministry would have hosted several vaccination drive-thrus. What was the response like?
Well, we had a drive-through at KK gas station, that's at Unity. I think we had, I would say, a moderate response. A number of people came out, and surprisingly, a lot of people also came by walking. So I think the activity generally was a successful one. We also had one on the East Coast, and that too had moderate success. But we'll continue to do them to make sure that people have more access to getting vaccines.
Okay Minister, can we have a regional breakdown of the number of persons vaccinated so far?
Well, so far we've had persons receiving their first dose would be 231,766 persons receiving their first dose. That would be approximately 47.6% of our adult population. And those receiving their second dose, that's approximately 106,344. That would account for 21.8% of our population. So we can consider those persons with their second dose to be fully immunized. In terms of the regional breakdown, for first dose, so far we've had in Region 1, 59.3% of their population would have now received at least the first dose of the vaccine. Region 2 would be 43.5, Region 3 at 46.9, Region 4 49.1, Region 5 at 50.1, Region 6 at 55.6%, and Region 7 at 47.5%, Region 8 at 32.2%, Region 9 at 46%, and Region 10 at 14.6%.
Okay, Region 10 hasn't moved since the last time we spoke.
Very slightly.
Okay, Minister. And that's for the first dose. What about second doses?
Second dose, we have right now Region 1 at 21.8%, Region 2 at 22.2%, Region 3 at 20.2%, Region 4 at 24.6%, Region 5 at 23.3%, Region 6 at 23%, Region 7 at 18.5%, Region 8 at 12.3%, Region 9 at 17.6%, and Region 10 at 6%.
Now, I understand that we're expecting Sinopharm vaccines shortly. Can we have an update on this?
Well, we're hoping that we'll get the 100,000 doses that we have purchased from Sinopharm. Those vaccines are due sometime this week. So we're working with the shipper to make sure that we get those vaccines in.
I know the last time we spoke, you would have said that you're still working out some arrangements to ship the Johnson & Johnson vaccine through the African Union. How have those discussions been going?
Those we are waiting on the estimated time of arrival from the African Union platform. We have been in discussions with them, but we don't have a final date as yet.
Okay, Minister.
Similarly, we are working with COVAX to get a date for the shipment of the AstraZeneca vaccines, but so far we haven't received anything.
Okay, thank you for that, Minister. Now, last week was Rehab Week, and we touched a little bit on COVID-19 and long COVID, but can we delve a little bit more into that today?
So, what is now referred to as post-COVID syndrome, I mean, after somebody would have tested negative, if they had COVID, and whether it's the mild form, moderate, or severe form, after they would have tested negative, they continue to experience symptoms. And so a new diagnostic entity, if you like, has appeared in the literature over the last several months, and that is something called post-COVID syndrome. And you're considered to have post-COVID syndrome if, having been discharged from the hospital, or if you had mild symptoms and you got better, you recovered, that you continue to experience symptoms. And these symptoms is after, let's say, a month, and continues for the next 6 months. So different people might experience different things. As you know, we would have had in Guyana about 19,891 persons who would have been infected. And of those, 17,712 persons would have recovered. Now, with those recovered persons, some of them can come back with symptoms. They're no longer COVID positive, but they can come back with symptoms. And in the medical literature, the symptoms can range from symptoms that affect your respiratory system. So we have been seeing, or you would see, persons with labored breathing, meaning they're having difficulty to breathe. Some of them might have decrease in their lung capacity because of the trauma that would have occurred when they had the COVID infection, and that would have reduced their capacity to breathe, and hence the importance of the rehab people working with them. Some patients would have experienced some blood disorder, and after maybe a month to the 6-month period, they start presenting with some form of clotting disorder. So that's something that we have to look out for as well. Some of them present with what is called thromboembolic events. So that is something that we have to watch out for as well. Other patients would have signs and symptoms consistent with heart disease. This would include, again, chest pains, labored breathing, palpitations, fast heartbeats. So that is another area that we have to pay keen attention to. Then you have another set of symptoms that is categorized as neuropsychiatric symptoms. This would include people getting fatigued. Some people have consistent headaches. Some people have difficulty, what is called cognitive impairment, meaning that they have difficulty rationalizing things and so forth. They're having those types of difficulty remembering things. Sometimes that is commonly referred to as a brain fog. So you have a subgroup of patients that can present with these types of symptoms. You also have patients presenting with changes in their renal system, their kidneys, and that's another area that we have to do tests and to check and to manage. With the endocrine system, we have seen some people who had diabetes, and if they get COVID, it is more difficult to manage the diabetes. And in some cases, persons without diabetes after COVID can start presenting with symptoms of diabetes. So that's another area that we have to monitor our patients closely. Some people would present with thyroid problems, and that's another area, again, that we have to look out for. You have people who would have problems with their digestive system, and these viruses can be shed through that system, through the feces. So that's another area that sometimes after you have tested negative that we have to look out for. And in some patients, they present with hair loss. So a month after they've tested negative to 6 months, some people start losing their hair. So these are things that we'll have to look out for. And there are cases where children who have been infected can present with multiple system inflammatory syndrome. And we haven't seen any cases here, but it's something that we have to look out for. So even if you get COVID and you had the mild to moderate forms, you can later on present with these types of symptoms, because this set of symptoms have been seen in patients in other countries, and we are not going to be an exception. So we can see some of those things here. We have been running some continuing medical education here for doctors. So patients who know that they have been infected with the SARS-CoV-2 virus can come to any one of the regional hospitals, and I'm sure the clinicians there would be able to do the relevant tests to see whether or not they're experiencing any of these problems that I mentioned. In some other countries, they have developed specialized clinics. We haven't done so, but for persons coming back to the hospital, if they have these symptoms, would go to our specific clinics, whether it's in cardiology or psychiatry, to be properly evaluated and managed. But it's something that we have to look out for, and I'm sure that some of the people having been discharged from the hospital might have experienced some of these problems. The medical staff is there to work with them to make sure that we restore their health. And so if anybody of this 17,712 persons who would have recovered and continued to experience some of the symptoms that I spoke about, then I would encourage them to come to one of the regional hospital or the Georgetown Public Hospital for such an evaluation.
Thank you, Minister. Thank you so much for that, and thank you for your time today. This has been DPI's COVID-19 update. For more information, visit our website, dpi.gov.gy, and our social media platforms.